We're back.
Hi.
We are going to talk about challenges we face as injectors, injecting people in different points and times of their life.
So I can tell you worked really hard on making that topic succinct.
Specifically, not emotional differences, but age-related things.
Sure.
Yeah.
Or otherwise anatomically.
There you go.
Yeah. Anyway.
So, just right off the bat, in regards to everybody, the most frustrating area and the area I worry about most is injecting the forehead.
Yeah,
that's different from the 11s.
Yes.
It's between the
different muscle
brow
groups.
and the hairline.
So we have the corrugator. Ooh, look how important eyebrows are. Ugh,
Oh,
creepy.
man.
So we have the corrugator muscles right here, and they run into the procerus, and the friction between those two, I guess you call it the, what's the word I'm looking for?
The integration.
Yeah.
Where they intersect.
Yes. The intersection, I like that. Of where those two muscles push against each other, that's what commonly makes those 11s, right? Different muscle than the forehead muscles, the frontalis muscles.
Yeah.
Which, I always tell people that's like, their job is to raise the eyebrows. Well, if we can't raise the eyebrows because we relaxed it, people will feel heavy. Sometimes you're getting, the mascara on your eyelids kind of look.
And it just doesn't, it's not a good feel.
No.
People don't like the way it feels.
Yeah.
Even if we can demonstrate in before and after photos that there really isn't been any physical change.
When you feel it, you feel
don't like it.
Doesn't matter. Yeah.
Doesn't matter.
How it
Doesn't
looks.
matter how it looks.
And my heart
you don't
goes
like
out.
it.
I have a very sensitive forehead. If I get a smidge too little, I feel like this. And if I get too much, I feel like this. Regardless
And
of how
sometimes I'll tell people if there's a really fussy forehead or I'm kind of concerned about injecting them, explain why.
Yeah.
Why might be because they have thicker skin or they have a very small space between their
or
eyebrow and
when
their
you're
hairline.
talking to somebody and they're like this all the time,
100%
naturally,
engaged.
they don't know it.
Right.
then-
They are contracted and listening to you completely with their
my
forehead.
Forehead's
Yeah.
not used to doing that anymore.
Yeah.
I've trained it pretty well, but with
And-
things being the way they are,
Yes.
it's been a while.
And so those will be considerations, and we talk about those. And we know that our goal will always be to undertreat somebody rather than treat them too heavily,
Yes.
unintentionally.
Yeah.
And so we always have, that conversation with people. And sometimes it's just that with the forehead, sometimes you just are never going to get it, right? Just because anatomically it's just not going to happen.
Yeah. So it's
and-
good to have that conversation
Right.
and to
For
just say,
expectations.
yep. There's techniques we can do to try to mitigate that.
And sometimes it's a matter of, it's like, well, I know that for 2 to 3 to 4 weeks after I'm treated, it isn't really how, I don't really prefer the way that this feels. It's heavier or, denser feeling. But I know that after that little bit of time, things kind of regulate and it kind of even out. And I like the rest of it. So
Sure.
I'm willing to put up with this for a little bit
Sure.
in order to get the rest of it I like.
Yep.
And other times it's personal preference.
Yeah.
Sometimes
Yeah.
it's just, yeah.
But it's always nice when your injector can tell you up front, like, here's our choices, here's our options, which one do you think you're going to prefer?
Yeah.
And then when we get there, do we like that?
Yeah, and both Mallory and I have done this for so many years that we're pretty good at anticipating
Yeah.
what somebody might
Yeah.
feel. You don't always hit it.
No, but generally.
But, yeah.
Well, and it's nice, too, even if you think maybe they might run into that, to give them a heads up and say,
Yeah.
like, wouldn't be crazy if you feel this, let me know.
Yeah.
Or we can always add more
Yeah.
if you want, because that's
and we'd
easy.
much rather, err on the side of undertreating.
Yes.
So just kind of like, just right off the bat, that's always going to
Yeah.
be the most frustrating area, or I think.
I agree. I think it's just always, I tell people
Yeah.
forehead's always, the hardest one. Plus, it can kick in differently on either side.
That's the other thing.
People can think, oh my gosh, you messed me up. And it's like, wait a week, because it takes
Uh-huh.
a while for it to fully kick in.
Right. So when we talk about the mechanism of action of any neurotoxins, we say the word Botox, but we mean the whole class of neurotoxins. We allow those medications 14 days for the full mechanism of action to take place from the time they're injected until we think that full inhibition of muscle movement should have occurred.
Yes.
But from that point on, our muscles can have a little memory and they can still mimic the movement that they usually make. And this is particularly true above the brows. And there's reasons for that. And we can talk about that a little bit. But so our brows, above our brows, it can take an extra week or so for those to really quiet down, because our muscles are smart and they have memory. So they continue to move. So we, as injectors, when we first started, used to tell people, 2 weeks, come back if you still have movement. Well,
You're right.
So we set people up for that expectation.
Because you might still have
That's on us, right?
Yeah.
We
learned.
expect you to have some movement now.
Yes.
We expect it at 2 weeks.
Yes.
And we want to see you at 3 weeks, unless there's some gross, asymmetry or discrepancy.
Yeah,
then,
sometimes I can. And there are some times where we'll decide somebody gets treated, differently on different sides of their forehead. But more often, it's just the use of the muscle. Like, I can do this because I'm using them differently.
And when we, talk about, we have this little suture line kind of right about, I'm going to turn you over. Yeah, right about there. And it's from about that point down to here that we lose the fat in our face the soonest and the fastest. And so that engages our brain a little bit. A little bit of biofeedback for our brain gets this little biofeedback that says, lift this up. Lift this up.
Right, because otherwise it's falling.
Yeah, or we feel like,
we feel like it is.
We have less volume here filling this out. And so then that muscle becomes a little hyperreactive.
Right.
And that's why it takes a little bit longer to, plus there's less cushion there with less fat there. So we're not hiding the evidence of the movement as we once did when we were younger. She's still young. I am not.
You're very sweet.
But so I'm not hiding it anymore. And that kind of leads us into another reason that we might inject neurotoxins differently is different age groups.
Another area that becomes hyper active is the DAOs, and that's something that
that's a depressor muscle that becomes dominant as we get older. The depressor, and if you watch particularly women of a certain age, you start noticing that women will start to respond to things like, I can't do it because I'm toxed. There you go. They'll do that. They'll respond and go, oh, and then they'll just, and it's so automatic. We don't even know it's happening. So that's a really great one to treat.
And lesser known is what I was going to say. A lot of people don't know that you can do that. You can.
And that also helps control this little marionette line here. It helps control, exactly, because when you work a muscle, muscles become bigger. And this muscle here tends to lay right in the area that everything kind of falls down. So you're working a muscle, plus you have a little bit of extra love there that used to be up there. And so that adds to that kind of pre-gel kind of thing. So if we can keep that muscle smaller, then we see less of this kind of jelly thing.
You're going to tell me when I stop making this?
You may.
Okay.
It was kind of cute.
That's kind of hard.
It won't be as you get older.
No, that's what I hear.
Just saying. And so I really like it. I love that on my face because it keeps this minimized.
Subtle tweaks that adds up to.
This might be all over the place today, but this all ties in together. Because why? Because then it's well, if we have this, then let's just put filler there. So why would that be a problem?
So the problem is because we lose mid-face volume, and like we talked about, we get redundancy and we get collection, we feel heavy down here. So, we've talked about before wanting the upside down triangle, having more volume here, narrower here. And if we start to flip that and we get more volume down here, filler adds more volume. So it may be a quick fix, and for the right client, that may be the answer. If it's a crease.
Yes, exactly. There are ways to do it, but we never want to fully fill that out.
No.
Widening the face this way.
That's not a cute look.
We might do a little bit for structural support or right in the line with the right product.
That crease.
But we never want to fill that, bring
You don't
that
need
all the way out.
Jay Leno look.
Yeah. So then also, we talked about the forehead being kind of a trouble area no matter, I shouldn't say trouble, an area that takes a more thoughtful approach.
Yes, that's a good way
no
to put it.
matter what age we are.
We pay attention.
But yeah, it's not a cookie cutter thing at all. None of it really is, but that is even less so. We have some patterning that is a little bit more straightforward on certain areas than others.
Yeah.
The forehead, there's
that
there's
goes out the
nothing.
window.
Yeah.
You just got to pay attention.
And then another reason we may want to inject differently as somebody ages, because kind of the normal changes that happen when we age, is that our eyebrows and our eyes become kind of closer together like this, and we start to get a little bit of hair loss. Everybody does. This little front part of our hair, our hairline recedes a little bit, making the forehead seem a little bit longer. And then our eyebrows, like we talked about, losing the fat and losing some muscle. And then if we've been treating with neurotoxin a long time, we're atrophying the muscle even more. And then things start to feel like they're heavy and falling. So then we look in the mirror and we look angry and sad and tired. And then the biofeedback tells us to lift that up and try really hard to pick that up. And, it's just a whole cycle of things. And when you talk about neurotoxins, they're a medication of opposites. So if you have a muscle that lifts and you treat it, it cannot lift.
Right.
So this being the one that lifts our eyebrows, and we treat it past a certain age, we may not achieve the lift we want.
Right.
And I haven't treated my forehead for over a year because I had about 17 pretty solid years of having neurotoxin, and I thought, I think I need to allow my forehead muscle some time to rebuild itself a little bit and kind of fill out my skin a little bit better, round out my forehead, and maybe not look so flat. So I have not treated my forehead, and I have movement, and you see the evidence of it.
I didn't realize it had been that long.
Yeah.
Good for you.
But it hasn't bothered me yet.
Yeah.
Now this is my area. I will treat this like it's my religion.
Yeah.
I will treat it until the day before I die.
Maybe the day of.
Maybe.
I would. I wouldn't.
Because this I hate. And also kind of lateral canthal. For me, I've got some special kind of I tend to get this little lymphatic fullness here, like little fluid.
It's the bane of my existence.
It really is. It's just such a struggle because I want her to give me filler.
I hate it.
Bites us in the butt
every time.
But if I knock out this orbicularis oculi muscle that kind of acts like a pump to keep everything draining, then I have collection of fluids.
I know.
Yeah. But the one thing I love that Mallory does for me, one of the things.
The one thing I do right around here.
There's one. One of the things.
Thank you.
I have a natural ptosis, meaning my eyelids kind of, just an age-related thing, and my eyelids just have gotten very lazy, particularly my left one, and I hate it. And we all have a little bit.
Yeah, sure.
Our eyes are different shapes and different sizes, and all of our asymmetries become more obvious and profound as we age, and we have pronounced.
Yeah.
So she injects my eyelid right at my lash line with a couple units of Botox, and again, the muscle there's more than one muscle in the eyelid, but the primary one that causes our eyelid to close, you treat it, and it can't come down as far, or it doesn't act as heavy. So when she does that for me, my eye is open a little bit more, and it's not huge. It's not. It's millimeters, but it's noticeable, and I love it. Another area, neurotoxin that is really nice can be to treat right along the jawline, and that helps that platysma muscle. It pulls down like this and gets tight as we get older to softly relax. And not even, everybody has a platysma muscle.
Which sounds funny when you say relax. You would think it would be straighter.
Right.
But when you
When
are
we say
understanding,
it.
yeah, we know that it's going to contour along your jawline, giving you a sharper looking jawline.
And for me, I love that. That's another one of my favorite places.
So good.
Chins are another place that are
Like
really good.
right under here.
So kind of the
all along
dimply and as
Oh,
we
I love
age, our chins like to spread out like this and kind of start to pull up. So by injecting neurotoxin, again, relaxing that muscle down so it keeps our skin smooth and the muscle kind of elongate.
All those little tweaks that can pull on here and give you, Oh.
And each one of those, each individual treatment, when you start doing these areas of the lower face, are not as, the effects are more subtle than when you treat the upper face.
Very true. Because they're, when you don't notice when you're moving those, and you don't notice as much when the relaxation happens, so it is subtle, but all those little tweaks add up to this like harmonious, beautiful thing that like no one else can tell that you did. But it's just like,
right, it's not going to be big, huge.
It's not drastic.
Smoothing out of a crease, like the forehead smooth out so quickly and
the physiology
easily.
of what the muscle is doing is so different.
But if you stay with the plan and continue to do these areas, they absolutely, cumulatively, long term. It just can't be beat. And get on it sooner rather than later. Because once these creases really full or really...
You can't get rid of them all the way with this tox.
And so for me at my age right now, I'm choosing to treat this area here like it's my religion. And then treat my lower, my chin, my DAOs. I haven't really done my lip yet. And then along and then the platysma bands too. So those are those little bands like that there you go. Hers are, so
mine are
that really a good demonstration of platysma bands.
Gosh, I'm going to keep a tally of your stuff today, Charlotte. Diane.
But sometimes with platysma bands, people can have very sensitive bands. And you can treat these, and ones over here that you've never seen before, all of a sudden pop out. And it begins a game of whack-a-mole.
That's a good way to put it, yeah.
So I'm treating these,
over here.
shoot, and
That's
other
funny.
people you can treat just these anterior ones and never see another one. So
that's true.
It's another just weird little area.
Conversation to have.
Yeah. But what else? Volume loss in the cheeks.
Under eyes. That's a conversation to have.
Yeah.
They, that's no cookie cutter, area. It's I think one of the areas that I think multi-level, multifaceted approach is super important because the skin, the tissue is so thin. You've got, texture issues going on. You've got color changes. You've got volume loss, and it seems like it happens all of a sudden. But when you try to go for a quick fix, that not always, it's not always just a quick, easy fix. Some people need to layer like a little smidge of dermal filler with like some PRP. We need some biostimulation, but you have to be
amazing.
Yeah, you can't just use anything under there. You have to, product choice is key, placement is key, technique is key, and then something from the top down to stimulate collagen. The Bright Ice packet is perfect for that. Some microneedling, some ultherapy.
Yeah, I mean, like she said, multifaceted.
It's a tough area
And again, filler choice is key.
So
there are, we love all the hyaluronic acid fillers we have.
Sure.
But that doesn't mean that they're all appropriate for all
areas.
Yeah.
No way.
And so, and the one thing is you may get away with having dermal filler placed under your eyes once, maybe.
Temporarily, it might be,
after one time, I tell people, and I know Mallory.
Again.
Right, and it's like, you hesitate to say never and always because it's always wrong and never right, except in the case of underline filler, under eye filler. It will always at some point need to be dissolved.
Plan on it.
Nobody did anything wrong. You didn't take care of it wrong when you left here.
No.
We didn't do anything, nobody injected it incorrectly. It's just that's the nature of filler in the under eyes. And it doesn't mean it can't be done.
Right.
It's just that you have to know that at some point you will need to dissolve it.
Yeah, and we just might need to treat the tissue.
Mm-hmm.
We might need to get everything prepared and ready so that it will look its best. Yeah.
Yeah.
Yeah, that's a good one.
Volume loss in the cheeks. We never want, I mean, kind of gone are the over dramatized
Yes.
cheeks.
Super sharp, super high,
UFO
fake.
type. You know, we know now that what we used to believe to be true, that if you treated these, it lifted this. It doesn't. It's an illusion, right?
Yeah.
Drawing the eye up. More importantly, it's returning people to a baseline that they once had
Yeah.
without making it look,
Too fake.
yeah.
Yeah, agreed. That's very true.
And again, not everybody's a candidate for mid-face
I've tried.
filler.
Trust me.
Yeah. And I am really a volume depleted person, so, but
I'm sorry.
it is what it
I
is.
don't.
I mean,
I
yeah.
stayed in my lane on that one.
I know.
Keep telling her no.
What else? Anything else? As far as areas to be,
I feel
I
like
mean,
those are good
lips. I mean, neurotoxin in the lip.
Oh,
We could
yeah.
talk about that a little bit,
Sure.
really quickly.
Yeah, really quickly. Go for it.
So I'm going to talk about, there's two different considerations for doing it. I'm going to talk about perioral lines.
Mm-hmm.
So sometimes that muscle's a sphincter muscle. It kind of comes together like a purse string.
Sphincter.
Yeah. And it can cause, combined with volume loss, and a lot of that is, it could be sun, it could be certain health habits that people have, it can be poor nutrition, different yo-yo dieting, but a lot of it is familial.
Yeah.
Loss of volume combined with the way that muscle moves and can cause perioral or vertical upper lip lines. When we can place the Botox neurotoxin in a way that allows that muscle to come together more softly, so
Yeah.
it can help
Quite
that.
as hard.
And then the
crease.
other thing we do with the lip is a flip.
Flip. So that placement is a little bit different because we're placing it kind of like right on that border there, and the goal there is a little bit different. Same kind of, same muscle, but instead of having it kind of curl under, we're flipping it up this way. So you get more real estate, you get more height in your upper lip. So it gives the illusion of a bigger lip, but it's all your lip.
Yeah.
It's all natural lip. So it can't really look ducky or anything. But it can feel different the
Yeah.
first time.
And again,
doing it.
opposite, right? The muscle turns under, and if you relax it out, you can't do that.
It's not this, but
Yeah. Yeah.
Yeah.
All right.
I think that's good.
That's it?
That's it. That's
All
all
right.
I got. Obsessions of the week. Pregnancy brain.
So mine currently is BBL. I had a BBL on Saturday, did some skin tightening and some brown, treatment for browns. And I just love the way it just, I don't know why,
It's
crisps things up
it
or
does.
something.
It
It's
does.
just,
Like photo
yeah.
finish on the.
And we don't love it any more than anybody else. I listened to a dermatologist this morning, and he was ranking certain treatments on a scale of 1 to 10, tretinoin and different things. And
Sure.
when he got to, when they asked him about BBL, he said it was a 20 of 10.
Wow.
Yeah.
I mean, he's not wrong.
So so it's really,
the
it's
math
pretty,
ain't mathin', but he's
yeah,
not
it's
wrong.
a pretty powerful statement. He's
Yeah.
just like, you can't go wrong.
I know.
On a BBL just because of the infrared light and infrared heat. So that's mine.
My brain went to the personal one first. So my son said something the other day that made me think the opposite, because he said, we were talking about babies and I don't know, body changing or whatever, and he was just like, Mom, how are you still young enough to have babies? And I was like, thank you, sweet child of mine. That is the most appropriate question to ask a very hormonal, emotional woman. Thank you.
Were you alive when Lincoln was president?
Or were you born in the 1900s or something? Ugh. I know. So that one was like, thank you, sweetheart. Great question. I'm so glad you asked that. Anyway.
And then my son and his wife are visiting this week from Seattle, so that's been fun. Yeah.
That is a fun one.
That's fun.
Okay, I know I just told someone the other day that I feel like I had like a thing that I was hung up on. I can't remember, but I just thinking on that train of thought, I've been telling a lot of people that my favorite thing lately to recommend is the Kissable Lips package. And I don't think I've used that before as an
I don't think so.
I don't think so. Because just like the eyes, perioral, very dynamic. Yeah. You have layers of, issues that can happen and seem like they happen all at once. And that does a lot. If you combine Kissable Lips package with a little tox.
Yeah. And
fabulous.
Yes, that's another area to really talk really quickly about.
Yeah.
We, Caucasian women in particular, we whiteys, tend to age. Oh, see, she's Asian, so she's even better. Me. We age more. I know. We age more rapidly. Some estimates are 70% faster in this perioral area.
I had not heard that.
Yes, than people who have melanin in their skin. Melanin and collagen have a cohesive relationship and make all those structures more stable. So that's another thing. Prevention versus treatment.
Yes.
Prevent it before you
yes,
have to try
because
to treat it.
those creases can get tricky
and
to really
this,
smooth.
This is...
It's tough. So yeah, the Kissable Lips is a little bit of filler and some oil therapy. And then again, if you add the little bit of toxin there to keep the lines from creasing really hard, you've hit the bases.
Yep.
I call it my trifecta for that area.
Yep. Every 6 to 12 months. Boom.
Yeah, I told one of my clients, I remember, I was like, if this doesn't make your husband want to kiss you, come back here because, man, they just look so good.
Yeah. So, okay.
All right,
We're
end.
Done. Till we see you again.
Till next time.
Yeah. Like, share, and subscribe.
My son asked me what this was the other day. I was like, how do you know about that?
Wow.
I know.